All right, this should be good. Let's see what happened to the dental care in America. Like, what's the dental crisis about? 13 years ago, Bernie. Let's see what he's got going on.
Aspect of that healthcare crisis. And that is that tens of millions of Americans are unable to afford the kind of dental care that they need. And as a result of that, there is widespread and often not discussed, not seen, suffering in America. Today, by introducing what I believe is the most comprehensive dental care reform legislation in the history
Why is it so
of the United
quiet?
States of America, we are going to make progress in addressing that crisis. This bill is the result of the work of a whole lot of people and a whole lot of organizations. I especially want to thank Representative Cummings, who is now at a vote, and I expect it'll be
Well,
here
this
in
is
a
a
few minutes,
13-year-old
joining
bill.
me
Hold on,
in this effort and
let
for
me just
introducing this legislation in the House of Representatives. I also want to thank all of the advocates who are here today and others who are not here for supporting this bill.
talk so
We
slow.
have, as part of our coalition, representatives from the Oral Health, Kossaman and Erica Solway for all of their efforts. Let's be very clear when we discuss this issue. The United States of America is in the midst of a major dental crisis. 130 million Americans have no dental insurance. 1/4 of adults age 65 or older have lost all of their teeth. Only 45% of Americans age 2 and older had a dental visit in the past 12 months, and more than 16 million low-income children go each year without seeing a dentist. That should not be taking place in America. Simply put, the groups that need dental care the most are the ones least likely to get it. As chair of the Subcommittee on Primary Health and Aging, my office has spent the last several months conducting research, holding hearings and town hall meetings, and
So it was this bad 13 years ago.
listening to thousands of Americans express their opinion on this subject. In order to address the dental crisis in the country today, Congress must take very strong action and pass this bill as soon as possible. And let me just very briefly tell you what is in this legislation.
What bill is it? Tell me the
First,
bill.
As a nation, we need more dentists. The problem is there are other parts of America where we desperately need those dentists, and they're not there. Or if they are there, they are the Health Resources and Services
Hold on,
Administration,
can I
HRSA.
tell
They
which-
estimate that
which
we need
bill
nearly
this is?
10,000 additional dental providers to fill the current gap that we have today. But dental schools are graduating fewer new dentists than the number needed just to replace those who retire each year. Got that? We are losing more than we are gaining. Obviously, this is an issue that has to be addressed. Our legislation would begin to address this gap and would also expand the dental workforce to include alternative providers in order to reach underserved populations.
Underserved populations, right? With so many with needs, but the doctors can't pay salaries and college loans without charging high dollars. Well, and not still yet live in mega nice homes, travel, golf, etc. They can only write so much off on their taxes, and that usually goes to a friend who could possibly do them a favor someday and certainly could pay their dental work. Dental prices continuously increase, leaving way too many suffering, both young and old. Yeah, this, I was talking to my dad, trying to get help from my dad to see if he could help me out in any way, and, he was talking about, oh, it's so crazy now, like, I went in to get my teeth cleaned, and they charged me $225. I thought that was outrageous. You guys charged me $85 last time. I'm not paying a penny over that. And they let me pay $85, and they took that. And I was like, how? Like, how did you just get mad at them and tell them you're not paying it, and they just let you not pay it? That's crazy. That's just an old person tactic. Like, young kids would never get away with that type of attitude. But older people, yeah, if they start acting like that, people will feel bad and like, oh yeah, we probably can't do this. So, I don't know. It doesn't make sense. But then he couldn't believe that they charged me $650 to pull my tooth, and I was like, well, when I called to schedule it, they wanted $1,200, and I was like, okay, I don't have insurance, like, it's gonna be a lot. And they're like, okay, we'll see you when you get here. I was like, all right, went in, and I get there, and they're like, all right, so it'll be $1,650 up front for payment if you don't have insurance. And I was like, well, you said $1,200 over the phone. They're like, no, I wasn't on the phone, and we didn't know you didn't have insurance. And I clearly specified on the phone that I do not have insurance. I need to know how much it's going to cost before I go there. So they just blindsided me with that, and that was more. I only had like $1,400 or $1,500 in the bank. I couldn't swing 16. I was hoping for the 12. So they came back and they said, we can pull the tooth without anesthetics. It'll just be, you'll be awake the whole time, but you won't feel anything. We can do that for $650. So I took that. It was affordable. I had to stay awake the whole time. It was kind of rough. The tooth kind of exploded and broke into a bunch of pieces, and he had to pull it out in a couple different, like, sessions. But I got through it. It was fine. I went home, and I started healing from it. But that was like all my money, or half my money. And then I lost my second income, so I couldn't keep that up. I haven't gotten back up to the $650 extra for pulling the other teeth. I went to one dentist, Compass, I think, just the local general place for healthcare, and they didn't charge me anything for the first exam. They sent me to somewhere else that was more of a dental specialist place that could examine me, and they did an exam for like $150, and then they told me, this is too complicated for us to do a surgery here. Like, we need to send you to an oral surgeon. Like, this is too bad to just be pulled simply. We want to send you to someone who's like a specialist. So I'm like, great. So the second specialist that the specialist is sending me to, that can't be good. And I just spent my last $200 and I'm down to one job. So I guess I'll start saving up money again. And I'm still here working and saving up money. I'm actually not working now. I've taken the past 4 days off because I can barely talk. Swallowing's kind of hard. And chewing or eating food is completely out of the question. Like, the whole left side of my face is swollen, my whole jaw is swollen, my neck's swollen. Ugh. All right, let's see if we can figure out
Further, not only do we need more dentists,
what bill this was. Like, what bill number? Like, House Bill what?
need to make those in practice to start serving more low-income people. Only 20% of the nation's practicing dentists provide care to people with Medicaid, and only an extremely small percentage devote a substantial part of their practice to caring for those who are underserved.
So we can read comments
this bill
while it's going
addresses this
through.
by creating an incentive to increase Medicaid reimbursement rates for dentists by assisting the state. There are today successful school and community-based programs that provide
12
critical dental
years
services
ago and
to
nothing
those
has
who need them the most.
changed. Exactly.
Federally qualified community health centers, FQHCs, provide dental service to over 3.5 million people. In 2011, 80% of these health centers offered preventative dental service, and almost 70%
I don't think he's
offered
ever going to get
restorative
through. I'm never going to
service.
figure
And this
out.
bill includes grants to
Never going to figure out what this bill is, or if it ever passed, or if it's still floating around, or what people did to it.
do just that.
Ooh, there's an
month,
hour
we've
video
seen
up
a significant
there.
Expansions of FQHCs
Maybe
in
I
the last
do
7
that
years.
one next.
We have 6 beautiful brand
Shame in the dental care crisis in America. How can we make dental care more affordable and more available? Coverage begins momentarily.
When we talk about the healthcare crisis in America, I'm afraid that far too often we ignore a very important aspect of that crisis, and that is that tens of millions of Americans are either unable to afford or unable to access the kind of dental care that they need. As a result, there is widespread suffering throughout the country that largely goes unseen. This is an issue really that is not talked about anywhere near enough. Americans. The situation has become so absurd, and this is really quite
Yeah,
remarkable
okay,
that
this
we're
is an
able to
hour
do this today.
long. I don't want to
Aspect of that.
deal with that. Let's see what this is. Oh, this is also 13 years ago. Why is nothing new? Treating dental care as an afterthought has dangerous consequences. Well, of course, thinking about it too late is dangerous. You better do everything you need to right now. But, we've done everything we can do. That's why we're stuck here. If we could have done more sooner, we wouldn't be here. Ugh. That's pretty bad. 11 years ago. Man, how many people have died from tooth infections in the past 15 years? Let me check that. I want to see if that's a thing. Let's try 2020s. See what AI says. No specific statistics, but average annual deaths, tooth infection result in estimated 5 to 10 deaths per year. I would have thought it would have been like 200 or 300, maybe 500. Well, can a tooth infection become fatal? 61,000 hospitalizations and 66 deaths in the United States between 2000 and 2008. That was a long time ago. It is probably... Oh, this was posted... Why are they talking about 2008 when they're posting it 24? It's gotta be much worse by now. Hello, I'd like to ask if it's possible. Sometimes Reddit has some stuff. It's very uncommon. I think there are somewhere around 11 deaths worldwide each year. I think when we didn't have antibiotics, it was a top 5. Well, I mean, my face is kind of swelling up. My neck's kind of swollen. Went to the ER and they said there's no swelling and there's no infection. So they didn't give me any antibiotics the last time I went. And they did like 6 months ago, but that was for the other tooth. And that was right when I was getting it pulled. So the dentist actually gave me the antibiotics, not the ER. How dental care works in the U.S. Dental care without insurance. This should be helpful.
At Spectrum,
I think I already seen this one a little bit.
Unlimited possibilities. Spectrum transforms your
get out of
gaming
here.
experience.
Line wraps all the way around here.
I think I already seen some of this.
Nearly 47 million Americans have no health insurance.
16
But did you know
years ago.
more than twice that
Why
many
is
have
everything
no dental
so
insurance? That's more
old?
than a third of the population, or more than 100 million people in
I
America.
guess no
Tonight,
one's
Seth
done
Dohm
nothing
shows us where
since.
some are turning for dental care in his series, The Other America.
A lot of people are in need.
Some of these people have been waiting for hours.
What time did you guys get here?
1 o'clock.
1 o'clock in the morning?
Others for years.
Can't remember last time.
To see a dentist, a luxury the uninsured can't afford.
You couldn't afford to see it.
Oh gosh, no way. Way too expensive.
In a country such as ours, it shouldn't happen.
Bruce Bergstrom's group, America's Dentist Care Foundation, organizes free dental clinics.
It's 5 o'clock in the morning.
The line wraps all the way around here.
Isn't that tragic? It really is to me. It's tragic.
They have a couple of nuts. This is crooked over here.
This one put together in just a day. An exhibit hall in Loveland, Colorado.
Watermelon toothpaste?
For 2 days, cleanings, fillings, extractions, root canals,
You got a lower left molar that's bothering you?
all performed free of charge in this massive clinic. 800
Oh, that
volunteers,
would've been
including
great. I
113
wanna go
dentists,
there.
have donated time and skill and pay their own way.
This is costing you a lot.
It is, yeah. But it's just a way to give back.
Pediatric dentist John Fales closed his Kansas City office for a few days and flew 5 members of his staff here.
But we're going to make them so they don't hurt.
One of his first patients is 8-year-old Jericho
This is
Rogers,
pretty
who was
awesome.
up at 2 a.m.
I
to
like
get here.
this.
He says he hasn't seen a dentist in 3 or 4 years. Are you surprised by looking at his mouth?
No, not at all. There's a lot of children running around in the United States that have cavities just like this, and mostly just for lack of good dental insurance coverage.
That means possible root canal, okay?
Jericho's parents need help too. His mom Cindy's job at a sandwich shop doesn't provide dental.
If she had to have 6 cavities filled by a dentist and pay for it, what would she have to pay?
Probably over $1,000.
$1,000, that's my rent payment a month.
Right.
So, it's either rent or...
Only
if it's gone, there's no roof over
$1,000
my
for
head.
6 cavities?
Their husband Richard has a mouthful of problems too. A job for a building supply company that doesn't cover it and a price tag.
When I had my fillings, they were always like $200 or $300 a piece. So I guess 5 or 6 fillings is about $1,000, maybe $1,500. That's close.
He can't afford.
No way. I have to sell my car.
You have to sell your car.
I have to sell my car to get to that.
About 1,500 patients were treated here, given around 1
I'm already trying to sell my car and my skateboard and anything else I have laying around. Video games, books, anything my friends want, they can buy. I need money.
$1.2 million worth of care.
I can't afford
No
it.
one will buy my car because the plates are expired, so everyone just keeps hitting me with a, if you pay me $500, I'll tow it away for you. I'm just like, it's not going to help me.
Expense, so it's a blessing to be able to bring her here and have the work done that we need to have done.
We're going to have to keep that for you.
A trip to the dentist isn't something most people ever look forward to, but for those who can't afford to go at all, a little pain is a welcome relief. Seth Doan, CBS News, Loveland, Colorado.
Wow.
Equitable.
Hold on, let's try this. Oh, 8 years ago, Trump made Medicaid changes. Leg braces. Trump's chaos is a cover to gut your health. Is it short? Oh, let's see this. This was just
Obviously,
yesterday.
if they did arrest Gavin Newsom, then it would change the narrative. And then it would be about the illegal arrest of a sitting governor who was elected by the majority of voters in the state of California, and not about a felon who is in the White House who is manufacturing chaos to distract from the fact that he is cutting hundreds of billions of dollars in needed programs that will kill people. This is about if it bleeds, it leads. So he has created and manufactured violence so that he can have a show on the television. But other people, older people, folks who are disabled, young people are going to be bleeding when Medicaid gets cut, when people are evicted from their homes. And this has been an illegal deployment of the Marines and the National Guards without the request or the consent of the sitting mayor and the sitting governor of the state of California. Obviously, if they did arrest Gavin Newsom, then it would change the narrative. And then it would be about the illegal arrest of a sitting governor who was elected by the majority of voters in the state of California, and not about a felon who is in the White House who is manufacturing chaos to distract from the fact that he is cutting hundreds of billions of dollars in needed programs that will kill people. This is about if it bleeds, it leads. That's right. So he has created and manufactured violence so that he can have a show on the television. But other people, older people, folks who are disabled, young people are going to be bleeding when Medicaid gets cut, when people are evicted from their homes. And this has been an illegal deployment of the Marines and the National Guards without the request or the consent of the sitting mayor and the sitting governor of the state of California. Obviously, if they did arrest Gavin Newsom, then it would change the narrative. And then it would be
The president warned that any protest on Saturday would be met with force. Can you clarify what kind of protest President Trump does support?
This is not even about dental now. It seems like everyone's just trying to say everything that the government's gonna do wrong is because of Trump now. And it's like, I feel like people in the government are just gonna do shit wrong regardless of who the president is. Like, we just need to figure out who is the people pulling the strings and, like, take their strings away, you know? This is probably good.
But on my first day in office, I ended the Green New Scam and abolished the EV mandate at the federal level. We abolished it, which is basically that everybody will be driving an electric car within a very short period of time. Now I know why Elon doesn't like me so much, which he does, actually. He does. But
Yeah, see, that's dumb. Elon already knew about that, like, before, I think. Oh, I didn't know I could do that. That's neat. Alright, so in front of me, I have a whole paper from the emergency room with all kinds of different dental help numbers I can call. It's gonna be nuts. I'm gonna put this up here so you can just read that if you want. And I'm gonna try and call these numbers and just, I'll try and edit out like names and places and stuff, but maybe we can see how awkward and strange trying to get help is for dental stuff right now. Hold on, let me grab something. Alright, so I'm not gonna do the whole video phone call dental help thing. It's too complicated, but I will have some updated videos on my further progress on my surgery and condition and what I'm trying to do to try and get help. So see you guys in the next video.